This is a full guide where we tackle the blueprint for optimal female menstrual health and fitness. For too long, the conversation around menstrual cycle has been limited to just one thing: preventing pregnancy. This view has led to massive misunderstanding, leaving millions of women and men who care about them clueless about their own bodies. Your cycle is not an inconvenience. It is a vital sign. It is your body's monthly report card on your overall health, metabolism, and stress resilience. The truth is, many women haven't understand their own hormones because we haven't discussed them crucially in public. This lack of awareness has real consequences, making it harder to spot early health issues like PCOS or endometriosis. So today we're going to break down the symphony of hormones that controls your body's every month, show you exactly what a healthy, predictable cycle looks like, and give you the knowledge to interpret your body's most important signal. It's time to move past the myths and understand the beautiful, complex system that is the female body. So if you are ready to take control of your health, learn the secrets of your body, hit that subscribe button, and turn on notifications so you don't miss any of our science-backed health and wellness guides below. To simplify the science, the menstrual cycle is primarily orchestrated by dynamic relationships between the brain and the ovaries, centered on two key hormones: estrogen and progesterone. These are not just sex hormones, they are messengers that impact everything from your brain to bones to your muscles and your gut. The process begins in the follicular phase, roughly the first 2 weeks. The brain sends out FSH, follicle stimulating hormone, which recruits a group of eggs inside the ovary. As one dominant egg starts to grow inside its follicle, it produces estrogen, specifically estradiol. This hormone rises, stopping the previous bleed and rebuilding the uterine lining. This is your estrogen dominant phase. Now, for most women, this is when they have their highest energy, focus, concentration, and libido. The feeling of aggression and performance is heightened, and you feel your best. When estrogen reaches a precise peak, the brain releases a surge of LH, luteinizing hormone, triggering ovulation, the release of the egg. The rupture follicle then reforms in the corpus luteum, which immediately begins producing progesterone. This signals the start of luteal phase, the second half of the cycle. Progesterone is the progestation hormone. It changes the uterine lining to prepare for a possible pregnancy. Progesterone is also a calming hormone. It increases GABA, a brain hormone, and often leads to deeper sleep, but also greater fatigue, higher appetite, and less concentration. Your body is designed to function differently in these two phases. In the luteal phase, the body shifts function because it believes a pregnancy might occur. Core body temperature increases, resting heart rate is higher, and the body shunts glycogen to the uterine lining. If no pregnancy occurs, the corpus luteum breaks down. Progesterone, estrogen levels drop, and the lining is shed. Your period starts and the cycle resets. Your menstrual cycle is a primary marker of your whole body health. It should work like clockwork. You should be able to look at a calendar and predict when your next period is coming within a few days. When it consistently deviates from your personal norm, typically between 25 to 35 days, it is a major red flag that should not be ignored. Irregularity is a warning. An irregular cycle, too short, too long, or highly unpredictable, is one of the biggest signs of underlying hormone health or systemic problems. For a young woman, losing a period entirely should not be seen as an inconvenience, but a sign of illness, overtraining, under recovery. Low estrogen during crucial bone-building years between 15 to 25 is detrimental to long-term brain, bone, and cardiac health. Pain is not a badge of honor. Women often conditioned to downplay their pain, viewing a high pain tolerance as a badge. But excruciating pain during a period is not normal. Pain that keeps you out of your activities of daily living, forcing you to call in sick or to work or cancel social plans, is a warning sign of endometriosis, a chronic inflammatory disease. This pain is often a primary reason women spend up to 7 to 10 years seeking a proper diagnosis. The quality of your flow matters. Your period should not cause you stress or lead to anemia. Light periods might signal low estrogen, while heavy periods can lead to iron deficiency anemia, low ferritin, which causes fatigue and its widespread problems. Relying on the pill for years prevents you from establishing a baseline normal, making it harder to recognize when these red flags appear. The number one leading cause of dysfunction and a major factor in modern female health issues is insulin resistance and chronic inflammation. This underlying metabolic issue for 80% of women with PCOS, polycystic ovarian syndrome. The world around us, our sedentary habits, high stress environments, and poor diet and processed foods promotes insulin resistance. When your cells constantly see high glucose, blood sugar, well, they become less responsive to insulin, the hormone that keeps glucose enter the cells. This creates a high state of chronic inflammation that directly poisons nerve and egg health and interferes with normal hormone communication. PCOS is a symptom, not a cause. See, PCOS is a metabolic condition where the ovaries are responding to its high insulin level. While you're genetically predisposed, the severity of the symptoms, irregular cycles, weight gain, higher male hormones, is absolutely influenced by your lifestyle choices. The solution is the foundation. The strategy to combat this is not a gadget or a fat diet, but a return to foundational health, anti-inflammatory nutrition, a plant-forward diet high in fiber to promote gut health and stabilize blood sugar, skeletal muscles. Building and using skeletal muscle is one of the most effective ways to combat insulin resistance and improve metabolism. Sleep. Quality sleep, when your body is active, fights inflammation and insulin resistance. Actively decreasing chronic stress prevents the body from constantly flooding your system with glucose, which worsens insulin resistance. Here's a few things that you can do to increase your body's menstrual system. Eat healthy foods. What does that mean? Healthy, high-fiber vegetables. You should have at least 7 to 10 cups of vegetables every single day to work with your body. Next, it's sleep. Your body needs about 7 to 9 hours of sleep during menstrual cycles. When it's not, it's going to need a little bit less. If you work out and exercise, developing skeletal muscles, that helps with insulin resistance, then your body might need a little bit more rest and recovery. Make sure you hydrate. You should be drinking at least half your body weight in ounces. So if you're about 150 pounds, you should drink at least 75 ounces of water just to maintain your healthy organs. Closer to a gallon is even better. Lowering stress in your life, making sure you have downtime, 10 to 15 minutes in the morning and in the afternoon. Meditation, breath work will also help. And lastly, lowering sugar intake. Your body should not be consuming sugar and glucose throughout the day. Decrease on the snacking. Try intermittent fasting where you're only eating within a 6 to 8 hour window period of time. And stop eating 2 to 3 hours before you go to bed. Your menstrual cycle is your body's built-in wellness detector. By understanding the biology of your hormones, you gain agency over your health and your future. You move from passively waiting for symptoms to actively interpreting and optimizing your body's signals. The choices you make now, from addressing diet and sleep to recognizing signs of pain and seeking a diagnosis, will profoundly impact your longevity and your quality of life. It is time to end the cycle of being dismissed. You have the ability to take control of your health. Don't let cycle irregularity or chronic pain be your normal. If you are struggling with chronic pain, irregular periods, or simply want to optimize your whole body health, ask the hard questions and demand answers from your doctors. Your future self, your bones, your heart, your mind will thank you in the long run.